my baby's in the breech position, so what do I do now? Or my doctor has told me that my baby's in the breech position, so what does it mean? In this video, let us look at all the information available around babies who are in the breech position. Hi, I am Saranya, the founder of Babypedia, a birth professional and a life coach for pregnant women. So first, what is the position of the baby? So when we say the baby is in so and so position, what we mean is towards the later part of pregnancy, the position in which your baby is lying down inside your stomach, which direction the baby's head is facing, which direction the baby's buttocks and legs are facing. So a breech position is where your baby's head is towards the upper part, towards your chest, and their buttocks, legs are towards your legs. So this position is called a breech position. So usually the most recommended position to have a vaginal birth and to have an easy vaginal birth is if your baby is head down towards your legs, with their buttocks and their feet up towards your chest. So if your baby is in a breech position, what can happen is if you go into labor, sometimes if your baby's buttocks come out first, it may be okay, but sometimes one leg, two legs can come, leading to a lot of complications and a risky birth experience for both you and your baby. That is why usually if your baby is in a breech position, your doctor may recommend going for a planned C-section or even waiting for labor to kickstart to know that your baby is ready to be born and then go for an cesarean instead of waiting for a vaginal birth. Yes, there are some doctors who are trained, who are ready to do vaginal births even if your baby is in a breech position. So if you are a mother who wants to try a vaginal birth even though your baby is in a breech position, then you will have to look out for such doctors and go consult with them. So now, if your baby is in a breech position, we now know that your doctor may recommend a C-section. So is this something that you can do during pregnancy to encourage your baby to turn head down? Or what may be some reasons why your baby is in the breech position? Now let's look at some reasons. One reason that a lot of people believe, a lot of scientists believe, is that your baby does not have enough space to turn around in the last few weeks of pregnancy. So one way to encourage your baby to turn head down would be by doing hip opening exercises or to do stretching exercises to increase the amount of space that is there in your uterus so that your baby turns head down. Another reason could be that your placenta is attached in a way that is not comfortable for your baby when your baby turns head down. For example, if your placenta is anterior, a little towards your cervix, then this can cause a lot of discomfort for your baby when your baby goes head down. So your baby will pop back to the head up position. So what you can do is get in touch with an expert, with a professional who can teach you a couple of exercises that will encourage your baby to turn head down. Again, we are not going to touch your baby. We are just giving you exercises to expand the space that is there in your uterus so that your baby can be encouraged to go head down. There is another procedure that's called ECV, that is external cephalic version. So this is again done by some doctors and some physiotherapists. So you will need to get in touch with your doctor if you would like to do that. Now, this is a process where the doctor will be putting pressure on your abdomen, on your uterus to encourage your baby to turn head down by just nudging your baby into that position. Some more tips that you can do at home without any complications would be applying ice towards the top of your uterus where the baby's head is. So when you apply that cold temperature, your baby may want to turn head down and move away from that. You could also play music towards your pelvis, the pelvis side of your uterus. Play your baby's favorite music that you have been listening to throughout pregnancy. This could encourage your baby to turn head down and go towards your cervix and your vagina. Again, you could talk to your baby. Babies understand. I always tell you in all my videos, your baby will understand. So talk to your baby, tell them, please get into this position so that we can go ahead and have a vaginal birth. So try all this. Along with this, get in touch with a professional to learn exercises if you are interested. Happy birthing and happy parenting. Don't forget to like, share with a person who will benefit from watching this video, and subscribe for more such informative videos. Take care. Lots and lots of love and strength. This is Saranya.